So now we're going to start the discussion about the diaphragm. So first you have to know the development. Now diaphragm is coming from four sources. Number one, septum transversum. Okay, so septum transversum, it is not only giving contribution to the diaphragm, the septum transversum also forms fibrous pericardium, the other derivatives of septum transversum. Okay, so septum transversum, the other derivatives. Number one forms diaphragm. In the diaphragm, it forms the central tendon of diaphragm, the central tendon part. It forms the central tendon of diaphragm. Okay, and the septum transversum, it is also forming fibrous pericardium. And it also helps in the formation of the connective tissue in the liver. Okay, so septum transversum is not only giving contribution to diaphragm, also forming pericardium and the connective tissues in the liver. Right, that's the first source. Number two, we have the mesentery around the esophagus, this part. So mesentery around the esophagus will be forming the area around the crux. It forms the crux of the diaphragm. We have right crux and left crux surrounding the esophageal openings. So the crux of diaphragm, it is coming from the mesentery around the esophagus. Next, contribution from body wall. That means the cervical somites. The contribution from the cervical somites, the myotome of the cervical somites. I told you in the third week development itself, in the somite topic, the myotome of the cervical somites form the diaphragm. Why? Because diaphragm is supplied by phrenic nerve, root value C3, C4, C5. That is the evidence we have. So diaphragm is supplied by phrenic nerve, C3, C4, C5 fiber. That means diaphragm is coming from, cervical somites. That is the evidence. Okay. So one last contribution for the diaphragm is the pleuroperitoneal membrane. Okay. So pleuroperitoneal membrane, initially we have a canal between the pleural cavity and the peritoneal cavity. We have the canal, the communication between the pleural cavity and the peritoneal cavity. Okay. Now this communication is closed by one membrane called pleuroperitoneal membrane. So pleuroperitoneal membrane close the pleuroperitoneal canal and help in the development of diaphragm. So diaphragm is coming from these four sources. What are those? Number one, septum transversum. Number two, mesentery around the esophagus. Number three, contribution from the body wall. Number four, pleuroperitoneal membrane. Suppose this patient is having the defect in the pleuroperitoneal membrane. This patient is having the defect in the pleuroperitoneal membrane, like this. Defect. Okay. Now defect in the pleuroperitoneal membrane. Now through this defect, yes, we have a communication. Now through this communication, the abdominal viscera, they herniate into the thoracic cavity. Now, that is called congenital diaphragmatic hernia. So next we're going to discuss congenital diaphragmatic hernia only. Now we have two hernia. One is Bogdaleg, another one Morgagnian. So we're going to know the difference between these two hernias. So Bogdaleg hernia, another one Morgagni hernia. Now Bogdaleg hernia is the most common congenital diaphragmatic hernia. It is most common congenital diaphragmatic hernia. Now this Bogdaleg hernia, it is occurring at the both right side and left side, but most commonly seen in left side, greater than right side. Whereas Morgagni hernia, again occurring at the both right side and left side, but it most commonly seen in right side, greater than left side. Next. Now where you see the defect? Now this is anterior and this is posterior. And this is medial. And this is lateral. Okay. So the defect in the Bogdaleg hernia is not at the front side, back side, posterior, and it is lateral. So defect in the Bogdaleg hernia is posterolateral. posterolateral. Now see the Morgagni hernia. Morgagni hernia, the defect is in the front side, again close to midline. So Morgagni hernia, the defect is anteromedial. Morgagni hernia, the defect is anteromedial. Clear? Now one last point. Now this hernia is due to, our Bogdala hernia is due to defect in pleuroperitoneal membrane. Very good. It is due to defect in pleuroperitoneal membrane. Due to defect in pleuroperitoneal membrane. Whereas the Morgagni hernia, it is due to the enlarged space of Larry. Actually, the space of Larry, it is nothing but it is a gap between the sternal origin and the costal origins of diaphragm. Between the sternum and the costal origins of diaphragm, we have one small gap. That gap is called space of Larry. The space of Larry is enlarged, that is called Morgagnian foramen. Through that, Morgagnian hernia will occur. Okay, so it is due to enlarged space of Larry. Now, space of Larry is nothing but it is the gap between the sternal origin and the costal origins of diaphragm. Sternal origin and the costal origins of diaphragm. Okay, if that space is enlarged, that is called space of Larry. Okay, so these are the difference between these two hernia. Again, the exams, very often we are getting questions from these two. Now, yes, that's all about the development of diaphragm. Okay, now we're going to start the discussion about the diaphragm. So, diaphragm, yes, we have to know about the origin, insertion, some basic points, and then we have to know about the structures passing through diaphragm, through the major opening and the minor openings, right? So, diaphragm we know is a muscular partition between the thorax and abdomen, yes. Now, what are the origins of the diaphragm? Diaphragm will take origin from the three bones. So, the three bones surrounding the diaphragm, what are those? In the front side, sternum, on either side, yes, costal cartilage and the ribs, and behind vertebra. So, diaphragm having origin from the three bones, sternal origin, okay, and then costal origin, and then vertebral origin, vertebral. Now, sternal origin, diaphragm is arising from two slits from the xiphoid process. Diaphragm is taking origin from the lower 6 ribs and its costal cartilage. Lower 6 ribs and its costal cartilage. So, vertebral origin, we have crux and arcuate ligaments. And the arcuate ligaments. So, crux we will see here in diagram. So, vertebra is arising from, yes, the crux, right crux and the left crux. Now, this is the right crux and this is the left crux, right crux and the left crux. Now, the right crux is arising from L1, L2 and L3 vertebra. Left crux is arising from L1 and L2 vertebra. Okay, so right crux L1, L2, L3, left crux L1, L2. Crux over. Now we have ligament, arcuate ligament. Now can you see the ligament here? Arcuate ligament, this one and this one. So this is number 1 and this is number 2. What is number 1 and number 2? So number 1 is the medial arcuate ligament. Medial arcuate ligament. Number 2 is the lateral arcuate ligament. Lateral arcuate ligament. So now medial arcuate ligament is nothing but which is the thickening of the upper margin of psoas fascia. Thickening the upper margin of psoas fascia. Now this is psoas major muscle. So psoas major muscle, psoas sheath will be there. The upper part of psoas sheath thickens and forms the medial arcuate ligament. Now what about lateral arcuate ligament? Now this is quadratus lumborum muscle. The upper margin, the thickening of the upper margin of fascia over quadratus lumborum muscle.
Now we also have one more ligament here. This is the median arcuate ligament. Median arcuate ligament is connecting the right crux and the left crux. Okay. So next is our median arcuate ligament. Median arcuate ligament. So median arcuate ligament, that is connecting the right and the left crux of the diaphragm. Right crux and the left crux. Now this is the origin of diaphragm. So diaphragm is arising from sternum, yes, and the ribs and costal cartilage, yes, and vertebra. Vertebra, we have arising origin from the crux, the right crux and left crux, and the three ligaments, median, medial, and the lateral arcuate ligament. This is the origin. See, origin insertion, when we won't get a question from origin insertion, for the completion sake I am saying just read once, just go through once. If sometimes the examiner may ask you about the origins. So to be on the safer side, try to know the origin and insertion. Now insertion, yes, these fibers are inserted to central tendon of diaphragm. Okay. Now central tendon of diaphragm, it is a trifoliate shape which is in the form of equilateral triangle. Trifoliate shape. Now this is anterior and this is posterior leaflet. This is anterior leaflet and these two are the posterior leaflet. Now central tendon of diaphragm, which is more on the anterior side, so close to anterior side, so that the posterior fibers are very long. The anterior fibers of diaphragm are very short, the posterior fibers are very long. Why? Because central tendon is more close to anterior side. Now central tendon is derived from, septum transversum. That is the source for the central tendon of diaphragm. Now septum transversum also forms fibrous pericardium. That is why the fibrous pericardium will be fusing with central tendon of diaphragm. Both have same origin. Again in the exam they will ask you. The structures derived from septum transversum. Septum transversum will be forming the central tendon of diaphragm, fibrous pericardium, and the septum transversum also contributes for the formation of liver. Yes, I told you already in development of liver. I hope you remember that. So septum transversum will form three structures: fibrous pericardium, central tendon, and liver, connective tissue. Okay. Right, that's all about the origin insertion for the diaphragm. Origin, sternal origin, costal origin, vertebral origin. Vertebral, right crux, left crux, and the three arcuate ligament. Insertion to central tendon. Central tendon in the shape of equilateral triangle, having three leaflet, anterior leaflet and the two posterior leaflet. And central tendon is more close to anterior side, so that the posterior fibers are very long. Is that clear? Right. Now next thing, we are going to discuss about the major openings and the minor openings. This is important. Okay. Now openings in the diaphragm. First we discuss the major openings. So major openings, three major openings we have. Number one, IVC opening, and then esophageal opening, and then aortic opening. So IVC opening, esophageal opening, and the aortic opening. So IVC opening is located at the level of T8. Esophageal opening is located at the level of T10. Aortic opening located at the level of T12. Now the shape of the IVC opening, which is quadrilateral shape. Esophageal opening, the shape is almost elliptical, This is quadrilateral, and this is elliptical, and whereas the shape of the aortic opening, which is almost the round shape. This is a round shape. Now where is the IVC opening? IVC opening, we see the IVC opening in the central tendon. 2017 AIMS question. The structures passing through central tendon, that is structures passing through the inferior vena cava opening. Okay. So now esophageal opening is situated to the left of midline. Okay. The aortic opening is situated behind the arcuate ligament. Behind the arcuate ligament. Okay. So IVC opening in the central tendon, esophageal opening the left of midline, and whereas aortic opening situated behind the arcuate ligament. Yes. Now what are structures passing through IVC opening? IVC opening, IVC will be passing. Everybody knows this. Definitely you will never get question about this. Everybody knows that IVC opening, IVC is passing. Don't expect these questions. What is the other structure passing along with inferior vena cava? I told you in the lung. Discussion of the mediastinal relations of the right lung. Along with IVC, I told you, yes, right phrenic nerve. Very good. So, right phrenic nerve is passing in the IVC opening. Okay. So, this is the point you have to know for the exams. So, our IVC, inferior vena cava and right phrenic nerve is passing through the IVC opening. Please underline right phrenic nerve. That is the point you have to note. Now, what about left phrenic nerve, sir? Please put one small box and then write left phrenic nerve will pierce the muscle on the left side anterior to the central tendon. Anterior to central tendon. So, left phrenic nerve pierce the muscle anterior to central tendon. Left phrenic nerve is not passing through IVC opening. Okay, only right phrenic nerve is passing through IVC opening. Now, next esophageal opening. Esophageal opening transmits esophagus. Okay, very good. And then vagus nerve, right vagus nerve, and then left vagus nerve, and then the esophageal branch of left gastric artery and its corresponding tributary. Esophageal branch of, yes, left gastric artery and its corresponding tributary. Now, what are structures passing through aortic orifice? Aorta, descending thoracic aorta will be passing through aortic orifice and then continuous abdominal aorta, and then thoracic duct, and then azygos vein, sometimes hemiazygos vein. See, hemiazygos vein usually which enters the thoracic cavity by piercing the left crux. So, hemiazygos vein usually enters by piercing the left crux of the diaphragm. Okay. Sometimes the hemiazygos vein which is passing along the aortic orifice. Okay. So, aortic orifice transmit aorta, thoracic duct and azygos vein. So, keep the hemiazygos vein as a last option. Okay, as a plus or minus option. Hemiazygos vein is the plus or minus option. Depend upon the other option you have to choose. Hemiazygos vein usually passing by piercing the left crux of diaphragm. Very rarely it is passing through the aortic orifice. These are structures passing through major openings in the diaphragm. Now, we also have minor openings. So, minor openings la, number 1, we have space of Larry. Now, space of Larry, it is a space between the sternum and the costal origins of diaphragm. Sternal and the costal origins of diaphragm. That is the space of Larry. Now, the space of Larry, who is passing? Our superior epigastric vessels. Yes, it is passing via the space of Larry. Number 2, we have musculophrenic artery. Musculophrenic artery which is passing between the slips of origin between 7th and 8th ribs. I told you the lower 6 ribs and the costal cartilage will give origin to diaphragm, no? That is the costal origin. So, we have a gap between the origins of diaphragm between the 7th and the 8th rib. So, that gap will transmit the musculophrenic artery. We do not have any name for this opening. Okay. So, we have a gap between 7th and 8th rib origin of diaphragm. In that gap, musculophrenic artery is passing. Okay. Then, the subcostal vessels and nerve, they pass deep to lateral arcuate ligament. Number 4, sympathetic chain. Sympathetic chain will be passing deep to medial arcuate ligament. Okay. Then last are our splanchnic nerves. splanchnic nerve, greater splanchnic nerve, lesser splanchnic nerve, least splanchnic nerve, they enter the abdomen by piercing the crux of the diaphragm. They pierce the crux of the diaphragm. So all the splanchnic nerve, they enter the abdominal cavity by piercing the crux of the diaphragm, corresponding crux, right crux or left crux, no? Yes. So these are the minor openings. These are the other structures passing through the diaphragm. Okay. Please remember major opening and the minor openings. The exams you may get easy question na, sometimes the examiner may give you structures passing through major opening, okay, but sometimes the examiner will give you tough question. So in that case you have to remember these structures passing through the minor openings, okay. Space of Larry, yes, musculophrenic artery, subcostal vessels pass deep to lateral arcuate ligament, sympathetic chain passing deep to medial arcuate ligament, and the splanchnic nerve enter the abdomen by piercing the crux of the diaphragm, okay. So that's all about the diaphragm. So last point in the diaphragm is the nerve supply of diaphragm. So diaphragm is supplied by phrenic nerve. See, phrenic nerve carries both the sensory fibers from the diaphragm and also they give motor fibers to diaphragm. So phrenic nerve carries sensory fibers and motor fibers to the diaphragm, okay. And the lower 5 intercostal nerve, nerves plus subcostal nerve. So diaphragm is supplied by phrenic nerve, the lower 5 intercostal nerve and the subcostal nerve. Phrenic nerve, that is a nerve carrying both sensory fibers and motor fibers from the diaphragm, okay. Right, now see this diagram. Now in this diagram, yes, we are seeing the major openings here. This is a vena cava opening, yes, located at the level of T8. Structures passing are inferior vena cava, right phrenic nerve. Esophageal opening, T10, esophagus, right and left vagus, right gastric vessels and the esophageal tributary to the left gastric vein. Aortic hiatus, aorta, thoracic duct, esophagus vein, sometimes hemiesophagus vein. Usually hemiesophagus vein passing via piercing the left crux of the diaphragm, okay, but rarely you will go. Hemiesophagus vein, please keep as plus or minus option, okay. Right, so that's all about the diaphragm. So diaphragm we discussed about origin, insertion, nerve supply, and we also discussed about, yes, the various structures passing through diaphragm.